Kidneys purifies almost 180 liters of blood in the body, and as a layman, what is it that we don't understand about what all does kidney does?
Majority of part of India is a rural or suburban areas where the people are not able to diagnose their disease.
India has the highest number of people today with CKD. It's almost 140 million is what I understood of it.
If you're indulging in some addictions or lifestyle hazards, so it's not a bad idea to just check yourself every 6 months or every 1 year.
I was also reading about this concept called crash landing, where like most number of people till the end of the disease do not have any symptoms, especially in the case of kidneys.
A good ultrasound of kidney and bladder can give you a lot of information about children's kidneys and the bladders and the kidney function.
Almost 14 lakh people don't have the facility of dialysis in the country, and they die because of that. India is the fastest growing country in the cases of CKD patients. India has about 140 million people with CKD. Welcome to the Namhya Podcast by Ridhima. Today we have Dr. Vipin Tyagi, who's Head of Department Urology and Kidney Transplantation at Gangaram Hospital, New Delhi. He comes with over 2 decades of experience in kidney transplantation and urology. He's done over 3,000 surgeries so far. He's a pioneer in robotics. Today, he's going to talk about the most common problems when it comes to kidneys. What are the symptoms? What are the diets that one should follow if you have somebody in the family with kidney problems? We're also going to cover a lot about kidney transplantation, donor health, recipient health, the cost of kidney transplantation in India, and some of the common myths that are attached to kidney transplantation. So if you have somebody in your family who has a kidney problem, this is a must watch. And as I always say, prevention is better than cure. So thank you so much, Dr. Vipin, for joining us. I think it's a pleasure to have you in our studio today. I was reading about, CKD, which is chronic kidney dysfunction. And India has the highest number of people today with CKD. It's almost 140 million is what I understood of it, which is literally 1/10 of the population. So 1 in 10 people today have CKD. What are the factors because of which we are at this situation right now?
First of all, thanks for inviting me and giving me an opportunity to share my thoughts. I'll tell you why everything in India is on the maximum side, because we are 140 billion people.
Right.
So even if 1% are being affected by a disease, the numbers become a very large number. So A is this. B, yes, the lifestyle changes, the incidences of the different type of a diseases which are not heard of earlier. Thirdly, the early diagnosis. Now, majority of part of India is a rural or suburban areas where the people are not able to diagnose their disease. They die something of, like they died from a fever. They never came to know whether they have a CKD or not.
Right.
Now the diagnosis have also increased.
Right.
So I think 3 factors. A, the diagnosis is being on increase. The lifestyle changes and all the pollutions, stress and new diseases coming into the market. And thirdly, we are number 1 in the population. So we will be number 1 in any disease.
Right. I was also reading about this concept called crash landing, where, like most number of people till the end of the disease do not have any symptoms, especially in the case of kidneys. I mean, what are these symptoms that one should look for on a regular basis so that, kidneys are in check?
So I think there are 2-3 factors about these. One is preemptive.
Yeah.
When I say preemptive, it means, say if somebody has a kidney dysfunction in your family, right? Or somebody have a long-standing diabetes, a long-standing hypertension.
Right.
Now these become the risk factor for chronic kidney diseases. Or somebody have a history of kidney stones.
Yeah.
So if you have these type of histories, then definitely you need to have your routine health checkup done.
Right.
You are absolutely right that majority of diseases have a crash landing, whether it is CKD or cancers, right? They are not they are slow progressive disease, and they become symptomatic when they have reached to a stage where it is significant. So one of this is getting the preemptive diagnosis done by regular health checkups. Secondly, if you're indulging in some addictions or lifestyle hazards, so it's not a bad idea to just check yourself every 6 months or every 1 year.
So 6 months to 1 month is a good time period, you're saying,
6
for
months to
checking?
1 year actually.
1 year,
1 month is too much of getting the test done. But 6 months to 1 year, if you have these risk factor of your family or risk factor of your lifestyle.
Right.
And lastly, if you have a mildest of the symptoms, say for example, many of my patients who are for kidney transplant, when I inquire about how you came to know about you have a kidney disease, I start feeling lethargic. I start feeling a little bit of swelling in my legs. I'm not feeling good. So if you suddenly have a bit of a change in your lifestyle, say for example, you are an active guy and on one fine day you start feeling for 5, 7, 10 days, I am feeling lethargic, I am not having that much of energy which I used to have, do get a test done.
Okay. But lethargy, I mean, I get lazy so many days. But doesn't that lead to having a kidney issue? I mean, I think I know a few people have that when there's iron depletion. A few people have that when they have fatty liver. What are those 2 or 3 tests, you have for a certain, for certainty that, okay, I have a disease or not related to kidneys? Like, what are those 2-3 tests that you would suggest?
So I think kidney function test is a good enough test to just give you a picture of do you have any kidney dysfunction or not. Plain urine routine test is also one of them, because if you are losing proteins in an excess amount in your urine, it means that your kidney is not filtering properly.
Right, which I think comes as a bubble in urine is what I've heard
yes,
about.
it could be as a bubble, but it doesn't mean that every bubble is because of the kidney dysfunction. Because if we convey this message through you that every bubble is a kidney dysfunction thing, then everybody will getting a urine routine done.
Right.
But regarding the letharginess, if it is a progressive and a constant phenomena, say after a week of good work, on the weekend you are feeling lethargic, it is okay.
Yeah.
But every day you feel that a month back I'm not like this, but every evening I start feeling lethargic.
Right.
So not a bad idea to just get a test done.
Test done.
Now I tell you one thing. Sometime you get any investigation done to diagnose a disease, and sometime you get the investigation done to rule out a disease.
Right.
Now these type of investigations which you done as a preventive measure are just to rule out that you're not having something bad in your body.
Okay. Let's say I have somebody in my family who has, some kind of kidney issue. What are the chances that I will also have it? Like, how much is hereditary responsible in this?
So you can categorize the risk of a disease coming to you by the hereditary way, depending upon what exactly the disease the patient is, the parents are having.
Okay.
So there are certain type of diseases which are hereditary. There are certain type of diseases which have a low risk of running into the generation.
Right.
So it's all depends upon what exactly the family members earlier have a disease.
Got it.
So say it happens in everywhere. Now genetic has come up in a very, very big way, right? So if you have if in your family cohort, if there are multiple persons with the cancer patients, then there's a very likelihood that you may also have a higher risk of developing cancer as compared to a normal population.
Right.
If you have a diabetes in your family, if you have a cardiac illness in your family, so there will be a higher chance as compared to the normal people around to have a cardiac or heart disease or diabetes, because that can run into the families.
Got it.
There are a lot of science now being investigating the basic cause of that genetic predisposition, and I hope that if the results comes out and they can pick up those genetic changes which can predispose a patient for certain diseases, then it will either lead us to diagnose that disease earlier, and if we can diagnose earlier, we can treat it very easily.
Right. So simple answer is that get yourself checked preemptively within 6 months to 1 year.
6 months to 1 year if you have a family history of any disease,
right.
If you have a risk factor of any disease. So for example, if somebody who is smoking for say last 10 years, 20 years, right, and he see a certain bit of change in his urinary pattern,
right.
so it could be a first sign of urinary bladder cancer.
Wow.
Right. Wow. So all these risk factors do predispose you to these diseases much more commonly as compared to a person who is not having these type of addictions and the family history.
Right. Coming back to the reasons, I was reading BP, high BP, and diabetes form the biggest factors for CKD. What are the other factors responsible? Like you were talking about smoking, and I'm curious to understand what are the other factors.
So I say diabetes and blood pressure, they are the very, very common factors for the kidney dysfunctions. There are certain nephropathies, we say IgA nephropathy. These are the inherent disorder of your kidney filters, in a very simple layman language.
Okay.
So those are the things which can also become a risk factor of having the kidney
तो ये
dysfunction.
hereditary होता है?
These are not practically hereditary, but they can be.
Okay.
Then stone diseases, they become a very one of the not uncommon cause of kidney dysfunctions.
Okay.
So if I put my stats, I had been involved in more than 1500 kidney transplants, and we see that there are good group of number of patients who have a history of kidney stones, which ultimately end up into the sacrifice of both the kidneys, and ultimately patient ended up with a CKD and for transplant. Right. A certain type of neurological illnesses like children's have, the child born with some neurological illnesses by virtue of which he or she is not able to completely empty his or her bladder and ultimately affecting both the kidneys. Those are the causes become. There are certain pediatric causes, say during the development in the mother's womb, the kidneys has not been developed in a way they should be. So say after the age of 15, 16, 17, that kidney is stopped working to its full potential, ultimately end up into having a CKD.
But in children, I mean, nobody would anticipate that a child can have a problem like that. What are the early symptoms in a child that one can, I mean, for all the parents who are watching this, what are the signs that one can see in their child to detect whether they, because naturally my mind will not go to a child getting their regular test done, right? So in children, what are the symptoms that you notice for?
Yeah, I'm totally agree when we are talking about the children as a patient. The parents have, and anybody can have a wishful thinking. He says that my son or my daughter could not have this. Right. So now we started from the early. So whenever a female become pregnant, that time you now get a good number of ultrasounds done. So they pick up all the kidney related diseases also.
Okay.
So they can either pick up, they can either predict, they can either preempt that this child may have unfortunately a disease which can affect his or her kidney.
Okay.
Secondly, if you see as a parents that there is something different in the urinary pattern of my child, right? Do take a pediatric advice. I always say one single test which if you ask me, which can give us the status of the kidneys in a children is an ultrasound. A good ultrasound of kidney and bladder can give you a lot of information about the children's kidneys and the bladders and the kidney functions.
And when you were discussing these patterns in the urination of a child, do you mean excessive urination or less urination, or could be both?
Most of the time it is urinary infection.
Okay.
So if a child, say, there is a big dictum in a female, because the female have a different anatomy as compared to the male. So if a female child is having an infection, yes, it is a common thing. It's not a very uncommon thing. But having a male child having an infection, it is a very uncommon thing. So if a male child have an infection, then the parents should evaluate him much more comprehensively to rule out all other things.
Got it.
Because female child have a very short urethra and a male child, because of the penile length, have a bigger urethra. So the incidences of infections in a male child are less, but are of much more significance. And in a female, they are not uncommon, and it may be it may be because of the unhygienic practices or whatever. So it is not directly related to any kidney dysfunction. So the incidences of UTIs, any change in the behavior change, like the child is feeling that he is not able to pass the urine completely, he is having an urge of that he need to go again and again to the urination for the urination. Those are the signs which can guide a pediatrician to get the evaluation for kidneys.
Done for kidneys. Interesting. Got it. You were talking about smoking and the effect on the kidneys. Of course, we spoke about BP and diabetes. What are the other lifestyle factors?
So one is smoking, definitely, because smoke has all the chemicals constituents which are bad for all the part of the bodies,
Right.
starting from your head to toe, right? So because these are the irritants,
Right.
so they can give a good pleasure to you, but ultimately they are giving all the unpleasant things to your body.
Right.
Apart from that, excess salt intake. So when we talk about processed food, the salt intake of these processed food is very high. So the excessive salt intake is something, because whenever you're taking any excessive salt, it need to be get out from your body by the kidney.
Right.
And if you're putting the pressure on the kidneys can be get affected. So that second thing, obesity, remaining as like a couch potatoes is the worst thing, because more inactive you are, more chances of getting your kidneys affected by n number of things.
Wow.
Right? Otherwise, lethargic lifestyles nowadays, perhaps in Indian subcontinent, is pollution.
Right.
Because whatever you are inhaling, that
Yeah.
ultimately need to be taken care by your major organs.
Right. Especially, I think in Delhi, we are literally smoking 200 cigarettes a day, and it's catastrophic.
Yes, definitely. So, whenever you're inhaling something which is significant, bad, that will affect all the major organs of your body, whether it is your brain or lungs or heart or liver and kidney. So, all these 5 organs will be get affected. And lastly, unsupervised medications. So that's also become sometime the cause for the kidney dysfunctions, and that is mainly because everything is now available on internet and chat GPT and all those things.
Right.
We are the patient, they are not conscious enough about the you can say understanding of a medicine. So for example, if somebody says, okay, for the pain you take Voveron, right, it becomes a very simple statement.
Yeah.
But you need to know that how much Voveron is good for you, when you should stop it. So the indiscriminate use of medicines or supplements can also become a very leading cause for kidney dysfunctions.
And technically, what exactly happens in the body? Let's say if I'm taking a painkiller excessively, let's say I'm continuing it for a month, 2 months, because a lot of people I know, they pop the pill at drop of a hat because मेरे को पीठ दर्द हो गई, मेरे को घुटने दर्द हो गए, right? So it's very casually done in India. But what is the technical effect on the kidney with this excessive medication?
So I tell you very simple language, which I tell to all my patients.
Yeah.
Now just in all of the kitchens in India, you have an RO machine.
Yeah.
Now what the RO machine do? It filters the water.
Right.
Right? If the quality of the water, the content of the water is too heavy to be get filtered by that filter will get affected.
Absolutely.
The same thing happens with the body. So kidney is a filter mechanism. Right. So if you loaded the kidney or the blood with all the constituents which are not the usual constituent of the blood, they will need to be get filtered from the kidney.
Right.
And that filter has its own limitations. So those medicines or smoking chemicals or excessive salt or excessive BP or excessive sugar, they basically clog those filters. So all the filters get disabled or not working to their own potential.
मतलब आपकी चाय की जो छन्नी है,
yes, चाय की छन्नी है, अब उसमें अगर आप चाय की पत्ती डालोगे मोटी मोटी तो उसमें कचरा अटकेगा. that कचरा जो अटकता है, that should be in a sufficient amount तो किडनी हैंडल कर लेती है. But if that amount become more than what kidney can handle, then ultimately वो RO का फिल्टर तो खराब होना ही है. The second reason of getting that RO on a faulty side is जो outlet होता है. You know everything, there is an RO outlet pipe होता है जो बाहर जा रहा होता है, and the extra water goes out. If you block that extra cord, then all the bad water will get accumulated in the RO filter, and then the filter again become bad. Right? And what you do, you ask the technician to clear the filters. Unfortunately, we do not have that mechanism. We do have a mechanism of clearing the filter at a regular interval by the body itself, but we are not privileged enough कि वो बार बार काम करे. हम उस पे इतना लोड डाल देते हैं कि there has to be a limit of every organ. So कई बार इतना लोड ज़्यादा डल जाता है तो उस वक्त वो किडनी का फिल्टर काम करना बंद कर देता है.
There's a lot of conversation these days around, liver detox, lung detox. Is there something called kidney detox as well?
So I don't see this kidney detox. One is the hydration. So एक simple सा logic है, अगर कोई भी चीज़ में गंदगी अटके या पानी से उसे साफ करो, the waste will go out. So hydration is one of the thing which I feel is a very good detox. Right. Apart from that, yes, there are in the market, there are a lot of things available for cleansing of the liver and the you are aware of most of them. So there are a lot of things, but in a moderate amount, those are the part of a good healthy lifestyle. I should not say those are detox things. A good healthy lifestyle. Integrate those things.
Correct. Absolutely. I think nothing beats the lifestyle.
Yes.
आप उसको करेक्ट नहीं करोगे तो बाकी कोई भी चीज़ काम ना करेगी.
अगर आप दिन की 20 सिगरेट पियेंगे और आप रात में बैठ के you have a good number of pegs, and in the morning you have all the detox things, detox things will not going to work.
For sure.
It will work only when you are not putting the pressure on your kidneys. So at the end of the day, you have to be taking something which is not affecting your organs. I use one of the line to all the juniors who do surgeries with me. Don't challenge yourself while you're doing a surgery. So I always to my patients also, don't challenge yourself. Don't challenge your kidneys or heart or liver or lungs to too much bad things. They can. There are certain people who say, फला बंदा तो 20 साल से सिगरेट पी रहा है, उसे कुछ नहीं हुआ. So that doesn't mean कि आपको कुछ नहीं होगा.
Right.
If something is bad, it is bad. And it should not be realized to you by making an accident. It should be realized to you before making an accident.
So I was amazed to know that kidneys purifies almost 180 liters of blood in the body, and that it does in 30 minutes, and it literally happens 300 times in a day. As a layman, what is it that we don't understand about, what all does kidney does, except from, removing toxins from the body, which is what we understand as layman?
So, kidney has basically 3 functions in our body. The number 1 function which you told, eliminate the toxins. So, what happens? Heart send the blood to the kidney. The 20% of the blood which heart send goes to the kidney, and the kidney has a purpose. Okay, you come with all the bad material. I will take out all the bad material and send back the blood which is pure. All the bad material goes out of the kidney, and all the good materials are left with the blood. Now this is a normal mechanism of kidney. Say RBCs, red blood cell, will be prevented, and all other bad things will be taken out, like excess of uric acid, excess of oxalates, excess of heavy metals need to be taken out. This is one function, that's filtration of your blood. This is a major primary function of kidney. The second function of kidney is to help in the synthesis of hemoglobin. So you must be aware of fact all the CKD patient have a less blood. Their hemoglobin is on lesser side. Because this is the second function of the kidney. The third function is blood pressure management. So if somebody have a high blood pressure, the kidney have an auto-regulation mechanism. So it just filter out most of the blood. It's release some hormones. I'm not going into the details. So that way you handle the blood pressure. So sometimes the blood pressure can cause the kidney dysfunction, and because of the kidney dysfunction, your blood pressure can also be on a higher side.
Interesting.
So these are the 3 factors which basically kidneys do, and that's where the difference between a transplant and a dialysis comes into picture.
Wow, I mean, since you've picked up the topic, might as well understand. I mean, what is the difference between the two?
So look, I start with the journey of chronic kidney disease. So if you have a chronic kidney disease, you have various stages of the chronic kidney disease, and it means that your kidney is not working properly. This is from kidney CKD1 to CKD4 at various level. Whenever some patient came like this, me as a transplant surgeon and our colleagues as a nephrologist, what they write is a renoprotective regime. They just want to prevent kidney to get further deterioration. ठीक है, आज वो CKD1 पे आया है, it should not become CKD2 in some time, or never become CKD3. In spite of all these intervention, renoprotective regime, certain time the patient end up into CKD5. That is called end stage renal disease. यानी अब किडनी ने फंक्शन करना बंद कर दिया है. तब पेशेंट को क्या होगा? His hemoglobin on a lower side. He will be loaded with all the toxins. He will be having a blood pressure which is not under control. Now because of kidney is not working, now there is nothing called protection. Protection वाला barrier टूट चुका है. Now the thing is that we have to replace the kidney functions. That is called renal replacement therapy. Renal is another scientific word for kidneys. Now there are two options of renal replacement therapy. One is dialysis and another one is kidney transplant. Now with dialysis what you are doing is you are just maintaining one of the work, that to take out all the bad toxins out of the blood, but the BP control and the hemoglobin thing will not improve. Because that is just a filter from which the blood is passing out, and you are taking out all the bad materials, and all the good materials are with your body. On the other hand, if you are doing a transplant, so you are replacing a kidney with a kidney. Now that kidney will do all the things. It will also control the blood pressure. It will also help you out to make the hemoglobin. So it was seen that on a dialysis, yes, your creatinine, which is a factor for showing that how much toxin you have in your body, it decreases down, but your hemoglobin will not improve, your blood pressure will not improve too much. But when you have a transplant done, the patient, we have seen, the patient comes more pale to us, and when he was discharged from after 7 days of a transplant, he is more pink. So his hemoglobin increased. His demand for the blood pressures medicines will also decrease. So that's the basic difference between the transplant, which is a much more natural way of replacing the kidney functions, as compared to dialysis, which is just a temporary thing and just doing one out of. So basically, by dialysis, you are getting 33% benefit, because one third. And by doing a transplant, you are actually getting 100% benefit.
फिर भी इतने लोग डायलिसिस पे और इतने कम लोग ट्रांसप्लांट करा रहे हैं, ऐसा क्यों है?
Because transplant के लिए आपको एक किडनी, healthy kidney चाहिए. And we have some legal regulations which are necessary, because of which there is a very limited pool of donors, whether they are living donors or cadaveric donors. So we have very less understanding that yes, at the time of your passing away in your family, somebody passed away, there is an option of organ donation. But that is not very popular or among the Indian populations. And I hope that whoever is listening to this podcast, that cadaveric transplant is something which is a very, very good way of ending one's life. Throughout your life, you can get the gift, which are of money or of emotions, but this is the gift of life. So if one person unfortunately passes away, and the family member take a good decision of donating his or her organs, that actually save multiple lives. But that awareness about those donations are very much limited in India. So that's the reason.
You know, between a live donor and a cadaveric, what is the split like when it comes to kidney transplants?
What is the
split like? How many kidney transplants happen with a live donor and how many happen?
I think in India, it's about more than 90-95% are live donors, and 5 to 10% are the disease donor or after the death of a person. One of the reasons which I personally feel is that people should understand what is the definition of death. So scientifically, a person who is brain dead is dead, right? But his heart may be working. So if somebody have a relative in an ICU with the monitor showing the heart rate of 84 and a BP of say 110, and a doctor walks to the patient's attendant and says, okay, he's brain dead, do you want to donate the organ? He will say the doctor is having something to do hand-to-hand business profile, because my father or my son or my daughter or my brother is having an ECG, blood pressure. Why he's saying he's a dead person? Because as per the definition, brain dead is a dead person, not the cardiac death is a death. So you have to, everybody need to understand that the death means brain dead. So you can have your heart working, but still a person is dead. And that's the ideal time for the donation of an organ. And to convince a person, because we cannot force a person to donation. We can only convince them, and we can give them an idea about this thing.
I think unlike in India, I know a lot of countries where it's an opt-out option available, that it will be by default given for donation. Your organs will be given to donation by default unless you opt out. I think something like that can really work in India, but I think we are in a very different religious, cultural beliefs, and I think there's a lot of time before I think that awareness will kind of come in.
We in India have we have a very varied cultural diversities.
Yeah.
So the people need to be mature enough for this will of donating the organs after the death. And one of the things which I always believe that say if in my family, if I'm sitting with my father, with my brothers, with my sisters, then I should very openly say to them, okay, in case of my death, right, I will be happy if you give my organs for donation. So if you discuss this thing at a dining table, yes, it looked bad discussing about death.
But I think it's as uncomfortable as deciding a will. I think.
But it is inevitable. Death is an inevitable event.
Right.
So it's not a bad idea. When you can decide about a will, you can decide about your term insurances. Just convey that message, because if a person died, the decision for organ donation need to be taken by his or her relative, not by him. So that will of me or wishes of me need to be convinced to my children, to my brothers, to my sisters, to my parents. It's not a bad idea to discuss these things.
I was reading somewhere that almost 14 lakh people don't have the facility of dialysis in the country, and they die because of that. 14 lakh is a very big number. And I think it's about 2.5-3 lakh people who get the facility of dialysis today. What is the infrastructure like, and I mean, what is it that's not happening currently from your eyes?
I think some things are good, are already happening since last 5-10 years. I think Prime Minister Mr. Modi has started some dialysis program in the district places, which is a very big dialysis program, which was initiated and which we are seeing that is getting some benefit to the patients who are in the areas where the dialysis things are not available. Secondly, as the number of the medical professionals are being on increase, so like Delhi is a saturated place now. So everybody who's now coming after his or her education want to go to the peripheries, and they are developing more or like same facilities which we are getting here. Yes, because of the inhibition of them to do a dialysis, because dialysis is a very significant event. So one of the apprehension for a person who is working in a rural place, if something happened to my patient, where I will send the patient, how I can handle the patient. So this is one of the apprehension, the medical part. And so these are the reasons. Sometimes the acceptance of the dialysis by the patient. So most of the time, and you also have learned, कि एक बार हमारा डायलिसिस हुआ तो जिंदगी भर होगा,
बिल्कुल,
right? Which is a fact also, which is a myth also. Now myth इसलिए है क्योंकि जब आपकी किडनी पूरी खराब हो गई है तो अब डायलिसिस होगा ही होगा. बिल्कुल. This is why it is a fact कि एक बार डायलिसिस शुरू होगा, so it will continue for the rest of your life. And there are situations where one dialysis is good enough to take care of your function, and then you can have a normal kidney functions. That depend upon the patient. So acceptance भी नहीं होती है patient की कई बार to get the dialysis done.
Is it painful?
It's not painful, but yes, it's not good. You are just somebody asks you to prick a needle in your body, and the whole blood is going out, and there's a lot of things happening physiologically in your body, and you are sitting in one place getting the dialysis done. It's a painful on a physical way, it's a painful on an emotional way, it's a pain for actually wastage of the human resources. Say for example, there is a guy who is 30-40 years of age, going for a dialysis 3 hours 2 times in a week, and that time in a daytime, actually you are losing 6 resourceful hours of a person. So it is a wastage of the human resources also. So it's a compulsion, and compulsions can never be a happy thing.
And typically, what are the complications? Like, let's say, आज मैं अपना dialysis शुरू करवाना चाहती हूँ, तो क्या complications आती हैं?
So complications.
Because I've heard a lot of people lose their muscle mass. There are a lot of complications that I've heard of.
So एक चीज़ तो ये कि because dialysis is only doing the blood filtration, so you will have all the side effect of the chronic kidney disease जो अपने हैं. दूसरा, in dialysis, what is happening in dialysis? Your blood is going into a chamber where there is a filtration is happening. तो सारे filter लगे हुए हैं, आपका पूरा blood वहाँ जा रहा है, वहाँ से घूम के आ रहा है. अब सोचो आपका पूरा blood इधर से उधर circulate कर रहा है. So lots of physiological changes happens. Vomiting, weakness, there's a term called dialysis disequilibrium.
Okay.
कि आपको डायलिसिस के बाद आपका बीपी लो हो जाता है, या आपको चक्कर आ जाते हैं, या आपको वॉमिटिंग आने लगती है बहुत ज़्यादा. सो दीज आर द साइड इफेक्ट ऑफ डायलिसिस. सेकेंडली, फिल्टर मशीन तो एक ही है, अगर उसे ढंग से ना देखा जाए, ना मेंटेन किया जाए, यू हैव अ चांस ऑफ एक्वायरिंग इन्फेक्शन एक्चुअली. So hepatitis B and hepatitis C are one of the most common infections which you acquire. भाई आपसे पहले जो डायलिसिस करा के गया, unfortunately if he has something in his blood, that can be transmitted to you also. So you have a chances of getting the infection. Thirdly, the average life on a dialysis, if we compare all the persons in the globe, is not more than 6 months to 2 years. So it's a very small time. If you take average life, so on a dialysis, if most of the patients, if they started dialysis today, after 6 months or 2 years, they may not be eligible for dialysis. They are not there for dialysis. So it does not provide a good quantity of life also. It is a compulsion because now the kidney has failed. You need to do something for living. That something for living is getting a dialysis.
Right. And how do you decide, looking at the patient, that who needs to go for a dialysis and who needs to go for a transplant?
Every person who is in end-stage renal disease is a candidate for kidney transplant. In a very simple way.
Okay.
Unless they are not fit for surgery, their heart is so weak, which only happens when they have ignored their disease for a very long time, or they are harboring any cancers.
Okay.
Because you give immunosuppressant medicines which can lead to proliferation of the cancer if you have already with you. So these are the two things where we say that okay, transplant cannot be done. Apart from that, from a 6-year-old child to a 70-year-old older man or woman, the transplant is the best option for a chronic kidney disease.
Got it. And typically, what is the age group in which you are seeing these complications the most?
Of
CKD?
They're the middle age. There are variable age groups, but the middle age persons are the mostly affected from the age of 25 to 45 or 50.
I was reading about CAPD, which seems to be relatively new. If you could talk a little about that and help our audience understand that.
So CAPD is basically peritoneal dialysis. Now, it's not a new concept, it's a very older concept. I'm doing the surgical procedure for starting the CAPDs since I think 2006 or 2007.
Okay.
So it's not a new thing, right? So what happened in CAPD? In CAPD, your abdominal cavity, it have a huge space. So what you do, you put some fluid inside the that cavity. And if you can go back to your science time in 9th, 10th, 11th, there's a process called osmosis. So there have that the fluid which is sent inside your abdominal cavity has some qualities by virtue of which it just pull up all the extra fluid and the bed materials out of the abdominal cavity wall. You leave the fluid for say about 2, 3, 4 hours and then you take out that fluid.
Okay.
This is called peritoneal dialysis.
Okay.
The good part with the peritoneal dialysis, you need not to go for a dialysis to the centers because it's not a hemodialysis. It can happen at home. The second good part is that it will not have all the hemodynamic changes because now your blood is not going somewhere,
out,
right? Then why the people are not getting the
CAPD? I was just checking this 6,000 cases in a year.
Right.
Yeah.
So the reason is that it's costly affair.
Okay.
You need somebody to change all the fluid things. So you need to be aware about what is happening with your inner dialysis. You just go lie down and some technician comes and start the dialysis. But that is not happening in a CAPD. You need a small surgical procedure to put a tube inside your abdominal cavity, which can get infected also, which can get blocked also. But the chances of that is less than 1 or 2%.
Okay.
In our series, it is less than 1 and 2% when there is a malfunction of the tube. And lastly, somehow the acceptance of the hemodialysis by the nephrologist and by the patients is much more higher as compared to CAPD.
Okay.
Right? And medically, there's one thing, CAPD is a slow dialysis. So suppose for example, if there is an event in your body which required very fast dialysis, then the hemodialysis, the normal dialysis is a better
preferred.
Option. Peritoneal dialysis is a slower option of dialysis.
Okay.
But yes, it is a very good option. So if you have the mindset, if you have the help at home, if you have a little bit of financial things good, then CAPD, in my opinion, is a very good options for all the patients who are going for hemodialysis.
So, talking about transplants, let's say if I've been told by the doctor that I have to go for a kidney transplant, what is typically the prep time? What is the infrastructure like? What are the costs involved? If you could take us through that.
So, whenever you are coming with the end-stage renal disease, if that you have to understand that any person who have a CKD5 or end-stage renal disease, the kidney transplant is the best option for your treatment. It provides you the best quality of life and the best quantity of life. So one thing is that this should be very clear to all the patients who have a chronic kidney disease.
Right.
Now for the transplant, what you need is a kidney, right? And you need a donor for the kidney. Now as per the Human Organ Transplant Act, anybody who is related to you, blood relative to you, can only donate. So there should not be any financial transactions between the recipient and the donor.
Which happens in India. I think India has been known for those kind of scams.
No. So it's illegal stuff. Yes, you do have the illegal persons doing all type of illegalities across any type of practices.
Right.
But in a good transplant centers like in ours or in any reputed transplant centers, the chances of doing illegal transplant are very rare. I should not say is not at all, because of various legal implications which one person need to follow. So that I'm going to detail. So once there is a person who is relative to you, say there is ex-patient, so his wife or her husband, brothers, sisters, parents, children's, they can donate. Or somebody who is a very close-knit family, chacha, mama, they can also donate. Then there are three type of evaluation. One is by the transplant surgeon, one is by the nephrologist. The nephrologist is the primary person to take care of your kidney transplant journey. And then there are transplant coordinators. The transplant coordinators do the medical evaluation of, legal evaluation of you actually. So they will establish that everything legally has been satisfied. So if you say he is my father, then you have to show the document that okay, he is your father, or she is my wife, then you have to say the document. Once everything is ready, medically the donor is ready, surgically the donor is ready, medically the recipient is ready, surgically recipient is ready, the transplant coordinator has done all the paperwork, they go to a committee, that's called authorization committee. Now that authorization committee check everything about the medical legal aspect of the transplant. They take a recorded conversations, the statements of the donor and the recipient, and once they approve that it is a legal way of transplant, then only you now started with the transplant surgical episode.
Interesting.
Where there is we retrieve the kidney from the donor and implant into the recipient. This whole process will take perhaps in our hospital, in Sir Gangaram Hospital, about 15 days to a month, depending upon how active is the recipient and the donor. How actively they can arrange the paperwork also, and how fit or unfit they are. Right? Say I have a young girl who came to me about 15 days back, and in 15 days now she's ready for a transplant. All the committee approval has been done because they are from Delhi itself. They organize all the paperwork. The donor is her father. So it's about 15 days to 30 days you are prepared for getting a kidney transplant done.
What are the parameters that you check for a donor from a healthy body perspective?
So in any kidney transplant program, I say donor is the most vital person, the most significant person. The whole transplant program runs on his or her consenting for kidney donation. It's a bigger thing. You cannot donate even a 10 rupees out of your pocket. Now here you are talking about taking a kidney out and giving to a person. So and that's the reason why we as a transplant team, surgeon and nephrologist, we are mainly responsible. We are responsible to the recipient also, but we are mainly significantly responsible to the donor. We do not want even a slightest of the doubt about the risk which can be there after the donation of the kidney. So if he or she who is donating the kidney have even 1% of a doubt, then we just say, okay, you cannot donate. right? So once the patient give a consent for donation, we always say that after donation you should not have any kidney disease. After donation, that should not hamper your normal life. Yes, you will have a trauma of a surgery, you will have a recovery of the surgery, but that are temporary phase, and after a month of donation, you will be as good as you are right now. For the same thing, we do laparoscopic donor nephrectomy, in which by keyhole surgery we take out the kidney out so that a longer incision can be avoided to the donor. And in any case, if the patient is not medically ready or in any situation during this whole journey of the transplant evaluation, the donor say, I do not want to give, we respect that decision. Right? So donor is very, very important to us. I tell you, in normal cases, in Gangaram Hospital, we do about 120, 150 cases per day. And if there is one transplant, like in Monday, I have 2 transplants lined up. So there are 2 persons who will be operated because they are healthy. Rest of the 148 patients will be operated because they have a disease. So these 2 persons are the donors. So we should be very, very respected to them. And we are. And we will be always.
What is the recovery time period for the patient?
For the donor, it is about 2 to 3 days in the hospital if you are doing a laparoscopic donor nephrectomy. For the recipient who get the kidney, it's about 7 to 10 days in the hospital. Once they, at the time when they are discharged, they are moving around, they are eating all the things. And I think perhaps after a month, the donor will as good as he is before the surgery.
And you're saying that they will be having a normal life with one kidney, or there are any do's and don'ts for them?
No. So only do's and don'ts when they are going to, they have any medical problem, and whenever going to a doctor, they should be good enough to tell them, okay, I have one kidney which has been donated. Apart from that, they have the same risk of disease, any disease. So for example, I donate my kidney. 10 years after the donation, I can have a diabetes also. So I have a same risk of developing any disease what I can develop with 2 kidneys. Now, why this idea of kidney donation come into the picture? Because as a surgeon, we used to take out one kidney if one kidney is having a cancer or one kidney is having an infection. And once medically we found that even with one kidney the patient is doing good, then this concept of kidney donation come into the existence.
It's also very interesting. I was reading that so let's say if I am the recipient and the kidney has to come to me, I will actually have 3 kidneys in my body because the kidney which was not working properly isn't removed out.
Yes.
Why is that? I mean, very strange for me too.
There is no fun and there is no advantage of taking out the rest of the kidney. Normally kidney are in the back. We implanted the kidney near the lower part of the anterior abdomen. So there is no advantage of taking out the kidneys of the recipient. One of my patients who underwent actually 3 times transplant. So she had 5 kidneys in her abdomen. So she's more lucky than all of us.
Absolutely.
And her story is very inspiring. She got her first transplant done when she's about in her 20s. Right? And that time, if I'm correct, that her mother has donated the kidney. See, after the transplant, she got married. She also gave birth to a daughter. So the whole life good. She was good with the kidney for 10 years. After that, she got the second transplant done, where this time the kidney donor was her sister, which that kidney runs for 10-15 years. Now her daughter have graduated and got married, right? And after that 15-20 years, again the kidney caused dysfunction. At that time, her husband has given the kidney. So look, by the virtue of kidney transplant, she have given birth to a new generation. So if she is just being on a dialysis, the whole next generation may not came into the existence.
When you go through a transplant, are you suggesting that it's usually 10 years of life that kidney can give, or was it just this case?
No, it's normally when we talk about, every patient asks कि मेरी किडनी कितनी चलेगी,
चलेगी, yeah.
राइट. सो देखो, जिस किडनी की भगवान ने गारंटी नहीं दी, हम गारंटी क्या दे सकते हैं? आई एम नॉट गॉड. सो वी डू आवर बेस्ट जॉब, एंड इफ यू डू आवर बेस्ट जॉब, then we have seen that after 10 years, about 30 to 40% of the kidneys, not the patient, kidneys goes off because of any reason. It could be rejection, it could be kidney dysfunction, it could be any other diseases affecting the kidney again. So about 30 to 40%. So whenever we do a transplant, I personally, there is no scientific rationale about it. I personally said, I am targeting 10 years. So if you are getting more than 10 years, that's a good bonus for you. We do have a patient who underwent transplant in 87 and 90s and ended up very good. So it is just...
I think it eventually drops down to having a good lifestyle and just maintaining...
Yeah, it's good lifestyle, taking all the precautions which has been advised by the transplant nephrologist, taking properly all the medications, avoiding all the bad things, adopting all the good things, and fortune.
Yeah, absolutely. What is approximately the cost that comes in a usual kidney transplant?
So it depends upon the center to center, but I always say to my patients who came to Gangaram Hospital, because in Gangaram Hospital we do not deal with packages, right? Packages are not for the treatment. Patient cannot be treated in a package.
Right.
If he deserves to be there in the hospital for 3 days, he will remain for the 3 days. If he deserves to be for 7 days, he need to be for the 7 days. So you cannot fix something which is dynamic into a package.
Right.
So we don't offer a package. I say to my patients, you should have at least 10 lakh rupees right now in your kitty,
right,
to go ahead with the transplant. Yes, if God is kind to you, if everything is going very as per expected, this expenditure can be less. Unfortunately, if the things are not moving as per your expectation, the expenditure can go up also.
Got it. So I was reading about your profile, and I saw a lot of work and research that has been done into robotics. Tell us a little about that.
Yeah, robotic surgery is something which has fascinated me a lot. I remember in 2008 or 9, I went to All India Institute. So there was a demo of a robot. And it is as if I am seeing the most beautiful girl of the college and I want him to be standing just next to me. I'm lucky enough that in 2012, Gangaram Hospital, being one of the pioneer hospital in doing all those type of innovations, they acquire a robot, and luckily I got an opportunity to sit in the robot. Now, what is robot actually means? So, I just given insight. To operate, we need to give a cut over the human body. The only reason of giving a cut to put the hand inside. Now, if suppose you have something which can mimic the movement of your hand inside the human body without giving a cut, so there is no need of giving a cut. So what in robot happens, there is an instrument which is going through a keyhole inside the human body, and whatever movement I am making at my wrist, they are being followed there. So it is more like जैसे कठपुतली होती है ना, आप ऊपर से चला रहे हो तो उसके मूवमेंट होते हैं, वैसे ही हम कुछ मूवमेंट्स करते हैं, and those movements are much more than the capabilities of my wrist. These are called endo wrist instruments. So they are much more capable of my own wrist. So they mimic all the movement which I am making outside, inside the human body. It is providing me a magnified 3D high resolution image. So when we are seeing it in any TV, we are seeing 2D. In 3D, we are having the more anatomical assessment of a thing. It is providing me the filter through which my tremors are being filtered out. So every human body, that have a tremor. So that can be filtered out. It gives me a luxury that I can operate while sitting on my couch, right, in front of a screen. I need not to touch the patient. It gives me a freedom to access those areas where my hand cannot reach. So, like for a prostate surgery, initially when the hand goes inside the pelvic cavity, it is more like a blind procedure. Now my camera can goes down, it can see where the prostate and everything is lying, and then my instrument can go down, and then I can do the surgeries. So by virtue of these things, we are able to do surgeries in a much more precise manner, much more better manner, and much more with a preserving all the functional activity of a patient. So that is what robotic surgery is all about.
Right, got it. And what are the success rates like?
It's almost 100%.
100%.
So it's not substituting any surgeries. It is just making a surgeons more versatile. I share one of the example, like for cancer prostate. When I was doing my medicals schooling in Lucknow, at that time we just have this word radical prostatectomy as a textbook literature. Nobody, every time in a surgery department say, okay, nobody is doing this radical prostatectomy. It was a difficult surgery. You cannot see what you are taking out, and it have a complications which cannot be controlled because you are just butchering out the prostate. When I'm doing my post graduation in 2002 to 2005 in MGM Indore Medical College, there we have no single case of radical prostate operated by in the department. We also learn about it. When I did my super specialization, there are few cases in a year, and now every week I am doing about 2 to 3 radical prostatectomies, and that is the story of everywhere. So since before 95, 96, the incidence of radical prostate are very less. In 2000, it become a little bit on a higher side. After 2010, when the robot came into the picture, now what robot is providing? It can provide the vision to that prostate. It can provide the luxury of operating inside the tight cavities where your hand cannot move. It is able to preserve all the sexual functions and the urinary functions of the patients, which are ultimately lost in an open surgeries. So at the end of the day, we are getting all the benefits of robotic surgery. So these are the benefits. So if you say success rate, it is successful. It has actually giving wings to a surgeons so that he can fly much more precise manner. Ultimately, at the end of the day, it is a show of a surgeon. But if you have a better instrument in your hand, you will be a better surgeon.
Got it. Where do you see the future of robotics from today? I mean, where is it going? Like, what are the recent developments that are happening in?
Lots of things. Now AI also came into the picture, right? I am into a lot of projects of AI where artificial intelligence, and when you take about artificial intelligence, it does not mean that machine is doing anything. So it has been just governed, it is just helping us out. So artificial intelligence coming into the medical field, generative AI also coming into the medical field. One of the very simpler way of understanding it, initially surgeon used to see your CT scan. He make a brain image, okay, this is the kidney tumor and I need to take this out. And now what is happening is, at the time of surgeries, there is an augmented reality or images generated by AI which can superimpose on my kidney. So when I'm doing a robotic surgery, I'm seeing the CT scan reconstruction over my kidney. I can feel, okay, where I'm cutting down. These are still in the investigational phase, but I think within 2-3 years, these will become a reality. The telerobotics, yes, it do have some medical legal implications. That is coming into the picture. So all these things are being on development. They are basically intended to give the benefit to the surgeon, to the patient. Now patient need not to be in the hospital for a longer duration. She can be discharged. And I always believe if a person can be discharged early, he can go work too early. So there is a lot of saving of human resources.
Got it.
And it's also give a luxury to the surgeon. It gives surgeons a good confidence.
And perhaps much more accuracy.
Yes, definitely.
Accuracy. Got it. Now coming to my favorite segment, which is diet and nutrition. We spoke about health, we spoke about lifestyle issues, smoking, alcohol. Now if I have, let's say, chronic disease, kidney disease, let's say I'm in stage 1 or stage 2, because people don't take it too seriously even in stage 1 and stage 2. What are those lifestyle and diet precautions that you suggest all your patients so that the kidney function is in place?
So the idea of renoprotective regime, which we are talking about when it's a person in a CKD 1 or 2, the idea is to just avoid all the things which can put extra pressure on the kidneys. So that includes a high protein diet, less of animal proteins, right? And taking the diets which are rich in potassium, right? So you can number bananas and all those things. They have a lot of potassium.
I think dry fruits also have a lot of potassium.
So those things should be avoided because they put an extra pressure on your kidneys. Taking excessive fluid because it's become a fashion. पानी खूब पियो तो आप ठीक रहोगे. But खूब की
वो तब करना है जब किडनी ठीक है.
Yes, खूब
that is to maintain the kidney. वो नहीं कर सकते जब किडनी प्रॉब्लम हो गई है. Which is where I think I see a lot of people going haywire.
देखिए कम और बहुत, ये बहुत रिलेटिव टर्म है.
Yeah.
राइट एक आदमी जो 4 लीटर पानी पीता है उसके लिए 3 लीटर पानी भी कम हो
है,
जाएगा.
बिल्कुल.
एक आदमी जो आधा लीटर पानी पीता है उसके लिए 1 लीटर पानी भी दुगना बहुत ज़्यादा हो जाएगा. सो यू नीड टू बी बैलेंस. आई ऑलवेज से इट्स ऑलवेज अबाउट जस्ट रिस्पॉन्स टू योर बॉडी डिमांड्स, रिस्पेक्ट योर बॉडी नीड्स. अगर आपको प्यास लगती है आप पानी पियो. अगर आप आज धूप में घूम रहे हो, गर्मी में घूम रहे हो, टेम्परेचर बाहर 50 डिग्री है, यू कैन हैव 2 bottles of water in one go. But if you are roaming around in a -1 temperature, then your body require less amount of fluid. So it's all depend upon the situation also.
Right.
So ये दो जो excess of phosphorus food and all those stuff, excess of unknown supplements. So there are a lot of unknown supplements where there is no regulatory things which regulated what this thing is having. So in India or in anywhere in the world, there are a lot of supplements which are coming into the picture, which does not show what they exactly having in it.
A lot of them I know about.
Yes.
Yes.
So you should be taking what is anything which is known to you. You should take it,
Yeah.
and which cannot put up extra pressure on your kidneys.
Kidneys. Got it. Because I think heavy metals,
Heavy
which is
metals.
found in so many supplements, also perhaps puts pressures on the kidneys.
Yes, and look, most of these persons, or even normal person, we go to the chat GPTs and various podcasts and all those things. You do not believe only in my word.
Yeah.
Just look whatever is content there. Have a scientific explanation. Do not go by a word of a person. He may be correct, he may not be correct. That you need to filter out what is a good information for you per se.
तो जिसको खुद नहीं समझ में आ रहा है, मतलब what is the advice? Should they just go by the word of the doctor, whatever he's prescribing?
Definitely. Look, any nephrologist, any urologist, any transplant surgeon, they are skilled professionals.
Absolutely.
So I'm not a transplant surgeon because मुझे बनना था. मैं transplant surgeon MBBS, फिर MS, फिर DNB, फिर मेहनत के बाद बनाऊँ. I have acquired this skill. Right? And that's the reason I'm here. I'm sitting in front of you.
Absolutely.
So if there is some skilled professional, take the advantage of that skilled professionals. है ना, जिसका काम उसी को साझे.
बिल्कुल.
If we keep every other person become a doctor and a lawyer and a influencer,
Yes.
they may not end up into doing something good.
Right.
So it is better to just
So
take
simple messages, not go with what Instagram is saying, just like
you
go
can
to
filter.
a doctor.
Yes,
Go
you
to
can
a doctor.
filter out the content.
Yes.
It have rubbish content also. It have the best of the content also. It's also depend upon you to take out the good content. So try to find out the good content. If in case you have a problem, go to your physician or nephrologist or urologist or transplant surgeon and take in guidance from them.
As a urologist, what would you suggest? Like, are there any supplements that can really support your kidneys?
So then there are no as such supplements which can support the kidney. Look, we sometimes become too much analytical about our body things. Right? It is all depend upon what we are doing, what we are consuming, what we are actually spending. So say for example, if somebody who is very hard-working person, like my chacha in my village, he take about that much of jaggery every day.
Yeah.
He can afford. He work
so much of
in the
physical
farm
exercise.
from morning to evening. Right? I cannot.
Right.
So it's all depend upon what type of a work I'm doing. So it is, you cannot standardize one thing to all the persons.
Right.
Yes, if you are living in a stressed environment, in a polluted environment, taking an antioxidant supplement is not a bad idea.
Right.
Taking a vitamin D supplement is not a bad idea. Taking some multivitamins is not a bad idea because sometimes the food is not able to provide those things.
Right.
But yes, excessive for everything is bad.
Bad. Got it. Understand. You were talking about kidneys and you said that stones is also a very big part of kidneys getting dysfunctioned. What are the reasons for, stone formation in the kidneys? How can we prevent that? And how am I at risk if I have a kidney stone right now?
So let me tell you, these questions everybody asks. What is the reason of having a kidney stone?
Because it is a very common problem.
But unfortunately, nobody knows.
Okay.
So you can give n number of reason of having a kidney stones, but in a very simple language, something which need to be get dissolved is not being get dissolved. So either it is less of the water, the solvent, or the less or the more quantity of that particular chemical,
substance,
right? So these are the reasons. It's very difficult to pinpoint a reason because so whenever I treat a stone from a patient, every time I counsel them, there is a 50-60% chances that you will have a stone again. And they ask me, Doctor, what I should do? I said, have 3-4 advices. Take a lot of water. Because at the end of the day, if you have more water, everything gets dissolved. Second, less of salt intake, right? Third, control all the diseases which you have. Like if you have a diabetes, control it. If you have a blood pressure, control it, right? Fourthly, avoid stress, right? And fifthly, pray to the God every day. Then in spite of all these things, you should not have a stone. Because in spite of doing everything positive about not having a stone, still you can have a stone. So it's a quite recurrent problem.
Right.
And whenever we do any treatment for the stones, it is for that episode where your stone has stuck up in the urinary tract, and we either take out with the medicines or by the surgery. Unfortunately, we are not able to pinpoint what exactly is causing the stone, except few conditions. Because we do not know what exact is the cause of the stone, we cannot treat it by an arrow.
Got it. And how much, if I've had a kidney stone in the past, or if it has recurred, let's say 2-3 times, what are my chances to have a kidney dysfunction?
So kidney dysfunction does not happen because you have a stone. It will only happen if you ignored the symptoms of this stone.
Okay.
Now one example I tell you, very simple. So say for example, on one fine day you have a pain in your stomach. You go to the doctor. You diagnose with a stone, 8 mm stone in the ureter. He write you certain medications. You get better. Now you are not having any pain. Right? You say, okay. Doctor said to you, okay, come and visit me after 7 days or 10 days. You say, now I'm not having any pain. There's no fun of going to the doctor again. He will charge me, right? There is this is the way they want
very
to,
common record.
This is the way they want the patient come to them again and pay all the fees.
Yeah.
So there is no fun. But it may happen that your kidney, your ureteric stone has lied there. It has not come out. And ultimately it will affect the kidney in a very silent way.
Got it.
So when you have, initially you have a pain because of the stone, if you get the treatment and your pain just vanishes out, it may be because your stone is either out or now your kidney are getting affected. So not having a pain does not mean that kidney stone is definitely out. You have to just prove it that it is out.
You have to get your test done properly.
Yes. So
it's
once
not
you
a
feel,
guesstimate job.
yes, when you feel that I have got rid of my stone, there is no disadvantage of getting an ultrasound done.
Right.
And just prove it that there is now no stone in your kidneys. So that put you at the risk of kidney stones. Right. Kidney failure because of these stones.
Right. So talk to us a little bit about what are the myths attached to kidney transplants and kidney stones.
So regarding the kidney transplant, there are a lot of myths. One of the myth which we already discussed, that when we called a patient a dead person, when there is a brain death, right, not the cardiac death.
Right.
So a person can be dead even if his heart is monitoring showing all the activities. Second myth, that after the donation my life will be compromised. No, it will not be compromised. It will be as good as it was before the kidney donation. It will remain the same way. You do not have any risk of the diseases higher because of the kidney donation, because we as a transplant team have done all the tests to make sure that you remain good even after the kidney donation.
Got it.
Thirdly, the myth is after the kidney transplant my kidney function will be absolutely normal and that to be lifelong, and I do not need any medicine. No, you will need a medicine, immunosuppressant, because that kidney doesn't belongs to you. That kidney belongs to the donor. So you need some medicine to calm that thing, right? You need to take those medicine for lifelong depending upon your progress, right? Kidney may ultimately can get compromised after 10-15 years. It is not a lifelong guarantee. So you may need to have a transplant done again.
Okay.
Lastly, people say for the transplant, your blood group should be matching. So now, yes, ideally it should be matching, but now in the major transplant centers, we are doing the transplant across the blood group also.
Okay.
So a person who have a blood group of A can donate a recipient to a blood group of B. So this can also be possible.
Are the
So
survival rates equal?
Yes, initially you need to do certain procedures to get rid of all the things in the recipient body against the donor's blood group.
Okay.
But once the kidney is there, the survival rates are equivalent. So even if you don't have a blood group which is same, right, you can still undergo transplant. Right, and there is another myth is that B positive and B negative. That positive negative does not have any significance right now for the kidney transplantations.
Got it.
So these are the common myths about the kidney transplant. If we talk about the myth about the kidney stones, first of the myth, the patient comes to us, say, okay, doc, I got my test done. I have a stone in my kidneys. I want treatment for this. So you do not need treatment of all the kidney stones.
Okay.
You need the treatment of the kidney stones which are causing trouble to you.
Pain, probably.
So that trouble can be pain, can be fever, can be kidney dysfunction.
Okay.
And that will happen when the kidney is stuck in the pipe which connect the kidney to the bladder.
Okay.
So if stone is lying outside that tract, there is no fun of getting a treatment done. And if that is lying within the tube, it is something which is of relevance.
Okay.
Second myth, bigger the stone, more is the problem. You can have a smallest of the stone which can make your life miserable.
Oh, this I didn't know. It's a very interesting one.
Yes. Thirdly, when the doctors take out the kidney stone, that's the end of the story. No, that is just one episode of your kidney stones. It can recur. Fourthly, there is any treatment for the kidney stone which can permanently eliminate all the kidney stone? Unfortunately, no.
Okay.
And lastly, you need surgery for all the kidney stone treatment? No. About 80% of the kidney stones or urotrigal stones passes on their own.
Oh no! Wow.
We make money only from the 20% of the patients.
You're saying 80%?
Yes, because
of the kidney stones do not need any treatment.
Do not need any treatment. Either they are not symptomatic or they are small enough which can be just. So that's why any advice by any wise friend of a patient works. So for example, if there is a 4 mm stone in your ureter, there is a 90% chance it will come out on its own. So at that moment of time, if some dadi has given you some nuska, that nuska is your treatment.
So you're saying it's a placebo?
Yes, it's a placebo. And last myth is, two more common myths. A, you should avoid taking calcium if you have a tendency of stone formation.
Okay.
Absolutely wrong.
Okay.
You take less calcium, the stone will form more.
Explain me that more.
Right. So, it's very chemical things. The stone is a combination of calcium and oxalate.
Yeah.
So if you take less calcium, there will be more oxalate available for stone formation.
Oh, interesting.
So if you take more calcium, this oxalate which is excess will combine and go out. So less of the calcium make oxalate or anything, I'm just giving an example, more available for stone formation. So if you take calcium in a good quantity.
But मेरे को तो लगता है doctors भी बोलते हैं calcium मत लो.
So that's why it is a myth.
Oh wow.
It never be told. A doctor who is a urologist will not tell you this thing.
Wow.
So that's why it is a myth. Wow. And lastly, you take beer and you will have less stones.
I think that's for all drinkers.
That's an excuse of having a beer. When you having a stone. I still remember one of my young patients. He's about 18 or 19.
Yeah.
She came to me and I write some medicine. And at the end of the discussion, she said to me, "Doc, whether beer helps to come to for my stone removal." And no, beer will not increase the chances of getting the stone out. Then he just turned over to her mother and said, "क्यों मम्मा मुझे रोज 2 beer पिला रही हो?" Man, you are the lucky guy. The mother is saying to the child, "Take 2 beers." So beer in a long run will increase the chances of stones. So you should not feel if I am a stone former, if I beer every day, I will have less of the stones. No, you will have more of the stones actually.
Got it. But isn't barley water known to help with kidney stones?
So anything, because barley water, anything which hydrate your body.
So it could be a barley water. To do with barley, it's basically about the water.
It's about the water. You take coconut water, you take normal water, you take barley water.
Got it.
right? Now, what happened with the beer? Because when you drink beer, it will have more diuresis effect. So
Yeah.
more do you passes the
Absolutely.
urine. So there's a myth of, okay, that is producing a lot of urine. So in a acute condition, it may help a bit, but for a chronic, taking beer every day
It's
does not
going to
decrease the risk of the stones. It will ultimately increase the risk of the stones.
Got it. Understand. And with this, we come to our favorite segment, which is the rapid fire segment with Namhya. So you have to answer very, very quickly to some of these questions that I'm going to ask you. Are you
have any
ready?
scoring for that?
No. Unfortunately, we don't have a reward a reward set
I
up
will
here.
try my
But
best. I will
I
try
think
my best.
the best reward that we've had is that you've come here and discussed this with us.
Yes.
Took out your time. So I'll start with that. So the first question is, what is the most common kidney symptom that most people ignore?
Weakness.
Weakness. Okay. Dialysis or transplant?
Obviously, transplant.
Transplant. One food you wished people won't eat for the sake of their kidneys?
Should not eat.
Drink?
No, should not eat excess of protein intake.
Okay.
Too much of protein intake.
Okay. And a no to whey powders, I think.
Yes, too much of that actually.
Okay. Tell me one most inspiring story of a patient, and it could be elaborate. I'm okay with that.
There's a patient of mine who was in her 40s, and her daughter, who is 19, she donated the kidney to her mother.
Wow.
And she was a young, beautiful girl. And in Indian scenario, no daughter is ready to give the kidneys to the mother. She's a well-educated, beautiful girl. We did the laparoscopy, donor nephrectomy, and it's always given me a very good inspiration. She has the whole life ahead of her, but she understands that kidney donation will not harm me, neither cosmetically nor functionally. It will connect to my mother more emotionally. So her ideas about donations are very clear. And after the transplant, say about 3-4 years after her transplant, on one fine day, I'm just roaming around in car market, and she just say hello to me, and I felt so good to see her enjoying her life to the max. So that is very touching.
Despite donating. So I think a lot of myth around donation which should not be there.
A young beautiful girl coming forward, want to have a cut in her abdomen, and still after 4 years she is enjoying her life like any young girl will be doing. So that's something which inspired me a lot. And that give us satisfaction to you also as a surgeon, that somebody is roaming around in this world because of you. It's not because of me, it is because of my skills and all God's grace. But that's good inspirational thing for me.
Interesting. If you weren't a doctor, what would you be?
It's a difficult task, because I always say I born to be a doctor.
At what age did you understand that मेरे को तो doctor ही बनना है?
Look, I was selected in engineering. On one fine day, my father calls me and say, मैं चाहता हूँ तू डॉक्टर बने. And my father is the biggest inspiration for me. मैंने बोला अपने दिमाग में तो कुछ नहीं चल रहा, तो चलो डॉक्टर बन जाते हैं. So that's the reason why I'm into doctor. And now retrospectively, I say that I was destined to become a doctor, and in doctor, a surgeon, in surgeon, a urologist, and in urology for kidney transplant and robotic surgery.
How did you choose urology as a stream?
Yeah, that's a very good thing. Look, urology have outcomes which are end of a treatment. Say for example, you take out the stone, and now you can say to the patient, okay, there is no need to come back to me. This is the end of the treatment. Today I saw a patient whose ureter tube, which connect the kidney to the bladder, get destructed because of any stone surgery. I reconstructed it by robotic surgery, by using the buccal mucosa. And now he came to me after everything. I got the CT scan done, CT scan showing everything absolutely normal. He said, "Doctor sahab, ab kab milna hai?" मैंने बोला अब मिलने की जरूरत नहीं है. So there is an end of this treatment. So, and that's one reason. Second, urology fortunately have everything. You have OPDs, because 40% of the urology is OPD practice, right? You have laparoscopy, you have lasers of all type. I use all type of laser. You do microscopic surgeries, you do endoscopic surgeries, you do open surgeries. I use robot also. I do transplant also. So I'm touching every technological advancement because of the urology. Because it is so versatile in that field.
God.
So,
And
and
so-
at the end of the day, because it have end of the treatment, you can have a wonderful sleep. You have
Yeah, and I
less
think you
critical
send
patients.
patients back happily. I think that's the
Yes.
wonderful gift you can give to people. Absolutely. One thing you do before you enter your operation theatre.
That is more like a secret, but yes, I pray to the God that
Okay.
everything should be good to me and good to my patient.
Okay. And who inspires you the most in the medical field?
It's a very difficult question actually because obviously parents are the first inspiration. My father. I get inspired from a lot of good persons. I cannot name one actually. I'm a type of person who, if see a person who is doing something good, I try to want that particular thing into me. So if you are speaking good, I want you to be okay. I take all the plus point of yours in my character.
Right.
So whenever I saw surgeries anywhere in the world, whether it is in the YouTube or I'm watching, going to a conference, if somebody is doing something which can make me better, I try to inculcate that particular property in me.
Okay.
So that become an inspiration. That can be a person who is junior to me.
Yeah.
That can be a technician in my OT.
Right.
So there sometimes technician give you an idea.
Absolutely.
Okay, do this. So he become an inspiration. So I cannot pinpoint one person actually.
Got it. And my last question to you is that there's going to be like a lot of people who are going to watch this podcast, and a lot of people would want to reach out to you. So tell us the most accessible way to reach out to you. Could be your social media, could be your floor at your hospital. Please tell us a little bit about that. And we'll probably put those details on the podcast also.
So call to my secretary.
Absolutely.
Simple. Because look, why I say call to my secretary, because when somebody calls a doctor, it is not just a call, okay, I want to see Dr. Vipin Tyagi.
Yeah.
He can have a certain questions in his or her mind. Okay, he is the right person.
Yeah.
Right? So my secretary, I have just told her, I just trained her that what I do.
Right.
So for example, I got a call today from Jaipur. Okay, Dr. Vipin, somebody has suggested your name and I want to see you because, okay, I said, okay, come on Monday. And she said, I have a gallbladder stone. I said, I don't treat gallbladder stones.
Okay. Yeah.
So if you just reaches out me from Jaipur coming to Delhi for a gallbladder stone and then you came to know I do not do gallbladder stone, and that become a
Very
painful journey
demotivating.
for the
Got
patient.
it.
So it is better to just connect with my secretary,
Absolutely.
put your questions there, or you can put on my social media also queries.
Absolutely.
Because that will make me treat you or give my consultation in a much more better way.
Got it. Thank you so much for taking out the time. I think I personally learned so many things that I didn't know about kidneys. Thank you so much for joining today.
Thank you giving me this opportunity, and it is wonderful talking to you.
My pleasure.
Without any manuscript. Talking by my heart and little bit of my brain. Thanks a lot.
Thank you so much. Thank you.
Thank you.